audible and visible? Can I get a quick thumbs up if my audio video is fine? So welcome to this next session of last minute revision of dermatology with me, Dr. Chesta Agarwal, your NEET PG educator on the best online platform, that is Unacademy. Now I've got All India rank 261 in my NEET PG entrance examination, and I'm here to help you out with your dermatology classes. Now, we before we start with today's session, let us very quickly go through the regulars, which is important. So, we are planning for a NEET PG All India mock test on April 17th, 9 a.m., which is absolutely free live test. You need to use a code to unlock it, and that is Chesta10. So, please use this code to get yourself enrolled. Please remember that it is free. You don't have to pay for this. So I would be requesting everybody to participate in this in as large number as possible, because we will have an all India rank prediction with this mock test. We are also providing a different type of subscriptions nowadays, which is known as Unacademy Lite subscription. Now, here you will get an access to all the practice tests, including subject-wise, system-wise test, full-length mock tests, PYQs, test series curated by the top educators, and 90 plus grand tests, including NEET PG, INI-CT, and FMG. I request all of you to please take an Academy subscription using a code CHESTA10. It's very cheap. I'll tell you the price. For 2 months, it is around 2100 rupees. So this is a very high time when you start practicing for your upcoming exam. We have also enrolled or launched a new MBBS Prof 1 batch where we have given you special prizes. So please use my code, same code CHESTA10 to get yourself enrolled. The batch will start from April 20th. We have also launched the daily practice papers, but this is only for those who have already subscribed to Unacademy. Immediately after the end of the class, you will get topic-wise questions. You can attempt 5 to 10 questions, whatever is given to you by the educator who have taken the live class. Now, other than this, we have two type of subscription. One is Plus, which give you an access to Unacademy classes, and we have Iconic, which give you an access to both Unacademy and Prep Ladder. I congratulate to all my students who have cleared their recent FMG exam. We do have a lot of free live classes on the app. So today at 3 p.m., I would be taking a free live class. It would be actually the continuation of this session. So everybody who like my class, this class, please download the app. If they ask you for any code, you can use this code. This is a free code which will help you unlock all the benefits of Unacademy. So please come and watch my session today at 3 p.m. The new batches which are about to start, these are the FMG 2022 batch starting on April 13th. It is a 1 month batch. Then we have a NEET PG batch again starting on April 13th, again 1 month. And we have a doubt clarification batch, which is something very new to any other platform. So here all your doubts of all the subjects will be solved by the top educators. So don't miss the opportunity. Use my code Chesta10 and be the part of doubt clarification board. It is must, because when we were when we were there at your side, when we were studying preparing for the exam, we have nothing like doubt clarification. Once we had the class, after that we should never, we would never seen the educator. So this is something which is very important for you at this particular moment. I would be highly requesting all of you to take a light subscription, which is only the MCQ based subscription. But if you want to have the theory classes also, you can attend the plus. 2 month is sufficient for NEET PG, INICT as well as FMG. Requesting all of you to please be a part. You might need a code to get 10% discount, and my code is CHESTA10. So we have good number of students already. Let us begin with today's first question. I hope everybody is ready. So let me just move this question a little on the lower end so that you all can visualize it. So this is the first question of the today's session. A 61-year-old male men with a past medical history significant of asthma, psoriasis present to the clinic for a visit. He has no specific complaint. Patient's examination reveals 3.3 centimeter lesion covered with a large scaly plaque on erythematous border overlying his elbow. What type of lesion is seen on the patient's elbow? So you have to describe this lesion. It's a question from the basics of dermatology, very, very important for all of you. Good afternoon to everyone. Robin, SVR, and other students. Please do answer the question. Amazing. I'm getting the answers already. It is the erythematous lesion, which is more than 1 centimeter. It is 3.3 centimeter in size. Horizontally elevated lesions of more than 1 centimeter. Very nice. The correct answer of this question is a plaque. Okay. Please remember the correct answer is a plaque. What is a patch? It is a flat lesion. Neither raised, neither depressed. Of more than 1 centimeter is a patch, less than 1 centimeter is a macule. What is lichenification? It is a triad of increase in skin color, increase in skin thickness, and increase in skin marking. Increase in skin marking. So lichenification is a very, very characteristic triad of increase in color, pigmentation, and thickening, and it is a feature of chronic eczema. It's a feature of chronic eczema. What is excoriation? It is a secondary skin lesion which occurs because of chronic rubbing or scratching of the skin. Again, it is a feature of a lot of conditions like eczema. Even you can see it in other conditions which has associated itching, for example, scabies. While a plaque is a horizontally elevated lesion of more than 1 centimeter, and that is what is described in this particular question. So amazing, all of you. The correct answer of this question is option number D. Please remember these type of questions you can expect in your upcoming exam. For more details, please join my 3 p.m. session today. Please join my 3 p.m. session. If you required a code, you can use this. My name, CHESTA, and then 10. Next question on your screen. Again, a very similar question. Let me move it a little lower so that you can all have a clear look. Please tell me the correct answer. A 30-year-old woman who is 24-week pregnant presents to the emergency department with fever, painful urination, headache. The patient's temperature is 38.3 degrees centigrade. Physical examination reveals bilateral, tender inguinal lymphadenopathy and painful genital lesions. On closure inspection, the patient's genital lesions contain clear fluid which measures 5 to 6 centimeter in or 5 to 6 in diameter. What is the appropriate description of the lesion? So again, a question from a very similar topic like that of the last question. So anyone can tell me the correct answer here. Very nice. Shaheen, Dr. Purva, Dream, SVR, Bushra, Vedashri, Kumar, PC. Very nice. Amalgamate. Now here the description given in the question is that the lesion has clear fluid inside it and it is less than 1 centimeter. It's a very classical description of a vesicle. Fluid filled lesion of less than 1 centimeter. And if it is more than 1 centimeter, it is known as a bulla. A solid lesion solid lesion of less than 1 centimeter is a papule, and more than 1 centimeter is a nodule. What is a pustule? It is the pus filled lesion. And what is a ulcer? It is the loss of superficial layers or complete layers of epidermis. Complete epidermal layer. Again, a very important question from basics. What are the definitions of the four options: ulcer, pustule, vesicle, and papule? This we have written on the question. The correct answer of this question is option number 3, that is a vesicle, which is a fluid-filled lesion of less than 1 centimeter. Let's move to the next question. I don't know why all the questions have gone little up, but anyways, I hope now it is visible. The question is that a 22-year-old man with no significant past medical, surgical, social, or family history presents to the clinic with an itchy rash. His review of the system is otherwise negative. Physical examination reveals crusting vesicular clusters in the upper back with a base of erythema and surrounding edema. So we have crusting and vesicular rash which is present on the upper back. The rash is extremely pruritic and they are also present on his extensor forearms. What additional could be seen in this particular patient? So please tell me, first of all, tell me what is the diagnosis here? Can anybody tell me what is the diagnosis? Think about this. Very important. I don't want anybody to answer this question in hurry. What is the diagnosis? Everybody is marking option number 1, but tell me what is the diagnosis? Option number 1 is not the correct answer. A young male with vesicles. This is something which should click something in your mind. Itchy vesicles on the extensors. Can anybody tell me the diagnosis? Itchy vesicles on the extensors. Anything should come into your mind. Please don't think about atopic dermatitis. In atopic dermatitis, in adult form, what is the site of the rash? It is the flexures. You never get rash on the extensors in a 22-year-old adult. So this is a question from dermatitis herpetiformis. Have you heard this term? What is dermatitis herpetiformis? Herpetiformis. It is a cutaneous manifestation of gluten sensitive enteropathy. And in gluten sensitive enteropathy, DH, you will see itchy vesicles on the extensors. And because of itching, you will rarely see any vesicles. You will see crusting or erosions on the extensors. So, one thing which is clear with this question is it is a patient from gluten sensitive enteropathy. Okay, so this is clear that this patient has some problem in the gut because of which they have malabsorption. And when they have malabsorption, they can also have associated iron deficiency anemia. So I think nobody have given me the correct answer. Please remember, in a patient of dermatitis herpetiformis, they have underlying malabsorption, and because of malabsorption, they can even get iron deficiency anemias, and they can have features like koilonychias, pallor of the skin, weakness, etc. Is this clear to all of you? I hope you all have understood this question. It's a very easy question, but it gives you an impression as if you are dealing with a patient of atopic dermatitis, and that is why majority of you have marked option number 1 as the correct answer. So I hope you have enjoyed this question. For more of such questions, you can visit me online on the Unacademy app. Please don't forget this code Chesta10 and get your subscription today. We also have a free live class at 3 p.m. today. Now, the next question is on your screen. A 19-year-old woman who presents to the dermatology clinic for a follow-up of a worsening acne. She was previously tried with a topical tretinoin as well as topical oral antibiotic, but there was no improvement. A physical examination reveals erythematous skin lesions, including both open and closed comedone, with inflammatory lesions overlying her face, neck, on the upper back. The patient asked about the oral isotretinoin. Which of the following is the most important step prior to prescribing oral isotretinoin in this patient? So, can you give me the answer here? What should be done before giving oral isotretinoin? Recently in FMGE December, we got a question from isotretinoin. If you remember, there was a question that a patient was on a drug which is 13-cis retinoic acid. Which of the following will be the side effect? I hope you remember. So 13-cis retinoic acid is oral isotretinoin. Side effects of oral isotretinoin is a very important question for your exams. Very nice. So I can see a lot of you with the correct answer. Dream, SVR, then we have Iowa, then Dr. Kumar. Everybody is right. So option number 1 says counsel the patient to avoid direct sunlight. Yes, this is important. Counsel the patient to wear a wide brim hat outdoor. Again, the same thing, very important. Counsel the patient to use a non-comedogenic drug. All of this is important. But among the 4 options, the one thing which you need to do, which is must before prescribing oral isotretinoin, is we need to do a urine pregnancy test, and it should be negative because it's a highly teratogenic drug. It can cause a lot of side effects. Okay, can anybody tell me what are the side effects of isotretinoin? Please remember this, please write it down. The commonest is dryness of lips or dryness of skin first. It causes derangement of liver function test, and it causes increase in triglyceride levels. It can cause pseudotumor cerebri, which is the space occupying lesion, pseudotumor cerebri. It can even cause a very rare side effect of diffuse idiopathic skeleton hyperestosis, diffuse idiopathic skeleton idiopathic skeleton hyperostosis, which is known as dish. And lastly, it is a highly teratogenic drug. Can anybody tell me how much should be the contraceptive period which a patient should follow before starting the isotretinoin, or sorry, before getting pregnant and stopping the isotretinoin? What should be a window period? For example, if you are giving a patient, so same patient, if you are giving isotretinoin and she comes to you and says that, ma'am, I'm planning pregnancy and I want to stop isotretinoin, so what you have to counsel? How much should be the gap? Please remember, there should be at least a strict 1 to 3 month of contraception after stopping the isotretinoin. It is said that isotretinoin remains for at least 1 to 3 months in the body. Okay, because it is a lipid soluble drug. So 1 to 3 option, Vedashri and pH. Now, if you get both 1 month, for example, if the question is 1 month, 2 month, 3 month, and 4 month, can you tell me what can be the answer? If both 1 and 3 month is given in the option, what is the best answer? Please remember the best answer will become 1 month. Strict 1 month contraception is required. For acitretin dreamcatcher, it is 3 years. Why it is 3 years for acitretin? Because acitretin, it is a lipid soluble drug, while isotretinoin is a water soluble drug. So water soluble drug remains only for 1 to 3 months in the body, but a lipid soluble drug remains in the fat cells for a period long as 3 years. So we avoid giving acitretin in a reproductive age female, because 3 years is such a long period that we cannot monitor the patient, and that is why we do not give acitretin in a reproductive age female. Acitretin has no role in acne. Acitretin only works for the psoriasis, not for acne. Next question is on your computer screen. Please tell me the answer. A 50-year-old woman who presents with an acute worsening of chronic rash on her arms, hand for past week. Review of system is significant for early morning swellings of the distal joints on her hands, feet. What is the correct answer for this particular question? Similar lesions are present on both the knees, inguinal area, scalp, involving more than 10% of her total body surface area. Laboratory tests are unremarkable. Which of the following is the next best step in the management of this patient? I'm waiting for everybody's answer. First of all, tell me what is the diagnosis here. First of all, tell me what is the diagnosis in this particular patient. Anyone? Very nice. So, this is a female with joint involvement and involvement of the skin. The skin lesions, they are very, very classical of psoriasis. They are present on the extensors like knee, inguinal. This is something which is usually not seen, but you can even get on inguinal areas. But scalp knees are the common site. In addition, the plaque have a very classical silvery scales over it. Both these indicate that we are dealing with a case of psoriasis, and because of arthritis, we are diagnosing as psoriatic arthritis. For psoriatic arthritis, please remember the treatment of choice is always methotrexate, and that is why the correct answer is option number C. But in general, I just want to discuss few points. If it is not associated with joint complaint, we have made a criteria that psoriasis with body surface area involvement which is less than 20%, we will treat with topical drugs. Topical drugs means it includes topical steroids, it includes vitamin D analogs like calcipotriols, it includes the topical retinoids like tazarotene, and some older agents like coal tar or anthralins. But if the body surface area is more than 20% involved, then you will have to add systemic drugs. And what systemic drugs we have? We have methotrexate, we have acitretin, which is oral retinoid, we have drugs like cyclosporin, and we have newer drugs which are a little expensive and they are biologics. So depending upon the body surface area involvement, we will choose the treatment of choice. Here, because it is a patient with psoriatic arthritis, the treatment becomes the methotrexate. Next question is here. I hope you can see the lesion. An otherwise healthy 16-year-old boy comes to the pediatrician because of worsening of the skin rash on his face and back. The skin rash is not painful or itchy. He has taken no medication and has no recent change in the diet. A photograph is shown. Which of the following organism is most likely responsible for this patient condition? Ma'am, the drug of choice in pregnancy and immunodeficiency, dream catcher. In pregnancy, if you see severe form of psoriasis, please listen to me carefully. In a pregnant female, if you see the severe form of psoriasis, which means erythrodermic or pustular psoriasis, in that case, the drug of choice becomes steroids, oral steroids. And in a patient with HIV and psoriasis, you cannot give immunosuppressive drug. So in that case, acitretin, which is the oral Retinoid becomes the treatment of choice. Understood, Dreamcatcher? Can I get a quick thumbs up if you got your answer? Please give me a quick thumbs up if you have understood. I have given you the answer of your question. Now, here the diagnosis, look at the image. Let me zoom the image. This is a young boy with lot of papules, few pustules, and you can even see some comedones. This is a very classical example of acne vulgaris. A very classical example of acne vulgaris. Now, please remember in acne, one of the bacteria which is involved is Propionibacterium acne, and this bacteria is also known as QT bacteria. This bacteria is also known as QT bacteria. So, this is the organism which is responsible for development or exacerbation of acne vulgaris. Next question is on your computer screen. The next question is on your screen. A 20-year-old male presented to dermatology OPD with multiple comedones. There is intercommunicating abscesses cyst with serosanguinous fluid. Which of the following statement regarding the underlying condition is true? Anybody can tell me the correct answer here. Very nice. So I think this is very easy for you to answer. Now it is a severe form of acne which is known as acne conglobata. It presents with nodulocystic lesion. For treating these conditions, you need oral isotretinoin. That's it. Nothing else can be used. Oral isotretinoin is a treatment of choice. Flushing and intolerance to heat and spicy food, it is not a feature of acne conglobata, it is a feature of acne rosacea. Oral antibiotic and topical retinoid, no. Oral retinoid is a treatment of choice. So the correct answer of this question among all four options is this. I hope this is clear to all my dear students. Next question is on your screen. Let me move it little more here. A 26-year-old male presented with increased hair loss. On examination, there is a patterned hair loss. Patient report that his father had a similar type of hair loss when he was young. This type of hair loss is known as which of the following? Dr. Bushra, Vedashri, Dream, Dr. Kumar, SVR, Dreamcatcher, Amalgamate, Deepa, Neha Zabeen, Dr. Tej, PH, Iowa, Dr. Kumar. Very nice, everyone. A 26-year-old male presented with increase in hair loss on examination. This is a patterned hair loss. Very nice. The correct answer of this question is Hamilton. So this is a male patient with a male pattern hair loss, and Hamilton and Norwood classification is used to classify a patient of male pattern hair loss. In male pattern hair loss, we have recession of the bitemporal and the frontal skin. We have bitemporal and frontal recession of the hairline. Moving to the next question. A 42-year-old man presents to the dermatologist with a rash on the extensors. Physical examination reveals sharply demarcated erythematous plaques with silvery white scales on the elbow and front of his knees. He has less than 3% of the total body surface area affected. Which of the following is the best initial therapy for this patient's condition? Now, I would request all of you to please answer this question. And for the answer of this question, I will be telling you this in my live special class, which will be start after 5 minutes at 3 p.m. on Unacademy Learning app. I request all of you to please download Unacademy Learning app. Go to my profile, Dr. Chesta Agarwal, and watch my free live class. They will ask you for a code. Use this code Chesta10 and watch my live class. See you soon at Unacademy app at 3 p.m. The answer of this question I will give on the app. So I would request all of you to please join the app at 3 p.m. I'll be starting with the class. So thank you all of you. I hope you have enjoyed this session. I would be joining soon at 3 p.m. on the app. You might need a code. It's a free live class. You don't have to pay for it. So just use this code and get yourself enrolled. Please subscribe this YouTube channel for more of such classes. You can also follow us on our Telegram group. We have a lot of Telegram groups. The name is same. And please give me a thumbs up if you like this class. Thank you, all of you. Good day. Take care. We'll meet at 3 p.m. on the Unacademy Learning app. Till then, bye bye. Take care and good day.